Have you been looking for a basic training on acceptance and commitment therapy? I'm Dr. Nate Hadley, and today I'll be covering ACT. Let's look at ACT as though we're examining the structure of a house. Now, in the 1980s, Dr. Stephen Hayes began to develop what we now know as ACT, or the 6 core concepts, based on a variety of different theoretical orientations. Let's begin with the foundation of ACT, which is functional contextualism. Now, functional contextualism takes a pragmatic and contextual approach to understanding human behavior and psychological processes. It really examines the importance of both the function and the context of the behavior, rather than breaking down the behavior solely based on its static traits, its form, or its structure. Now, in the context of ACT, functional contextualism guides therapists to view behavior as constantly evolving and influenced by situational factors, our thoughts, emotions, and past experiences. Let's move now to the first floor, which is applied behavioral analysis, or ABA. Now, ABA is based on behavioral principles that focus on observable behaviors and their relationship to the environment. ABA aims to identify and modify these behaviors through techniques such as reinforcement, shaping, or chaining. Now, from an ACT perspective, these behavioral principles certainly are acknowledged, but not the sole focus of the intervention. Another part of ABA is doing a functional analysis. Now, a functional analysis is really meant to understand the function of the behavior, which includes the antecedents, which are the triggers, and the consequences, which are reinforcers or punishers. Now, this analysis helps to identify patterns and determinants of behavior. Now, in ACT, functional analysis is certainly recognized, yet the focus extends far beyond that behavior analysis to include also cognitive and emotional processes. Now, let's go up one more floor, which is relational frame theory. Now, RFT is a behavioral approach that focuses on how humans learn language and cognition, specifically how we create and relate mental frames or connections between ideas, words, and experiences. For example, if I say the word cat, you and I might have a different experience with that word based on our life experience, what the word means to us, and some of the ideas that come into our mind. That is the basics of RFT. Every human begins to form frames or these relationships and connections to these ideas, words, and experiences. And it could be any word or any phrase that comes into our mind. Now, in the context of ACT, RFT plays a significant role in understanding and addressing psychological issues. This is because we attempt to understand language and the meaning that is attached to language. Now, RFT emphasizes that language is not just about communication. It also shapes how our thoughts, emotions develop, and the influences on behavior. Now, an important concept in RFT is cognitive fusion and diffusion. Now, RFT introduces the concept of cognitive fusion, which refers to becoming entangled or fused with thoughts and beliefs. Picture two pieces of metal being welded together. This is kind of what takes place in fusion or cognitive fusion. Oftentimes as human, when a certain thought or idea comes into our mind, it can lead to rigid patterns and emotional distress as we become fused or hooked with those thoughts. ACT attempts to then unhook us or defuse from these thoughts so we can look at them more flexibly. Now, relational frames within RFT identify the various types of frames, which include similarity, opposition, comparisons, and hierarchy. Now, these frames influence how we understand and relate to the ideas and experiences that we have as humans. Finally, contextual understanding is a concept within RFT which emphasizes the importance of considering the context in which language and cognition occur. Now, in ACT, this contextual understanding is crucial for helping clients respond more effectively to their experiences. Finally, the top level of the ACT house is the 6 core concepts of ACT developed by Dr. Stephen Hayes. In this video, we're going to take a look at each of these 6 core concepts and how they're utilized and applied within ACT therapy. So what is the aim of ACT therapy anyway? Well, it can be summed up in these words: First, psychological flexibility. ACT is really trying to help individuals become more psychologically flexible as they have thoughts, emotions, and go through experiences of life. And from a behavioral standpoint, it's looking at workability. How can humans begin to act in ways that are more workable and functional that takes them toward the life they want to lead? Let's understand psychological flexibility using some imagery. I like to picture two different types of trees, the first of which is an oak tree. Now, oak trees are great and have a lot of different strengths and characteristics, such as being sturdy, obviously made of hard wood, and having a firm and rigid structure. However, in the face of a difficult storm of high-powered winds or a hurricane, it's this rigidity that actually works against the tree because of its inability to adapt to difficult, challenging, or uncomfortable circumstances. Now, a palm tree, on the other hand, when faced with a high winds or hurricane, its flexibility allows it to bend, adapt, and accept the high-powered winds, the difficult situations that come upon it. Think about how this might apply to humans. The psychological flexibility that humans can develop is part of ACT therapy. The ability to adapt to difficult, challenging, and uncomfortable circumstances, and beginning to help our clients begin to act more flexibly and accept these difficult, challenging, and uncomfortable situations, not as a defeat, but part of who we are as humans in being able to adapt to the environment around us and still live fulfilling and meaningful lives. So what is the Hexaflex model? Well, think of it as a roadmap to understanding how ACT works. It involves the 6 core concepts that surround the Hexaflex, with psychological flexibility being in the middle. All 6 core concepts are in the service of helping clients develop this psychological flexibility, which once again refers to the ability to adapt and respond to the various situations and experiences that happen in life. Now, each of the 6 core concepts have lines that go through the middle of the Hexaflex to emphasize the relationship between each one. There's not one core concept that outweighs or outshines another core concept. And this is both the beauty of ACT, but also what makes ACT a little bit more complex and a little bit more confusing for those that are attempting to practice ACT, because it is so flexible in the way that it's practiced. It's not a linear model. It is a flexible model depending on what the client needs to focus on at the time. So let's take a look at each of the core concepts, beginning with the top of the Hexaflex, which is the present moment. Now, on this particular image, it also lists the inverse of that concept, which the inverse is usually what, according to ACT therapist, is what causes distress or psychological struggles in a person's life. It usually contributes to conditions such as depression, anxiety, and stress. So let's take a look at each of the core concepts and how they relate and help develop psychological flexibility. The first is the present moment, which is contacting the present moment. It's helping clients be in the here and now, which means flexibly paying attention to the experiences in the moment. Sometimes this requires being mindful and aware of what's happening within us and outside of us in a very non-judgmental way. It's noticing. Living in the present moment also can mean fully accepting and engaging in the lived experience rather than being pulled into our thoughts. Being in the here and now also allows us to make choices to live as the person we want to live in the here and now, rather than being pulled to the past or worrying about the future. Being in the present moment is a critical part of ACT therapy, as it emphasizes the importance of making choices and determining what we want to do now. Let's move on to the values core concept. Now, the inverse of values is the lack of clarity of one's values or core beliefs. So a critical aspect of ACT is helping individuals connect to their values and beliefs, or discover their values and beliefs. Those things or who or what is important to them in their lives. This helps create an internal drive for individuals during difficult times. Now, a connection to values also helps provide a clear sense of direction and purpose in a client's life, and helps a client to take action towards aspects of their life that are important and meaningful. Now, down to the bottom right is committed action. Now, the inverse of committed action is inaction, impulsivity, or avoidance. Now, committed action is not just randomly taking action. The committed word of committed action is the portion which means it's actively taking steps toward value-based goals. That is critical. Now, when you take committed action, it's committed action towards value-based goals even in the presence of difficult, uncomfortable, or challenging thoughts, emotions, or events. That is an important part of ACT. It's doing things in the service of your values even when it's difficult. At the very bottom of the hexaflex is self as context. Now, this can be one of the more difficult concepts to understand. This concept can be understood as a human's ability to notice what we are thinking and doing in any given moment. Sometimes it's called the observing self or the noticing self. Now, think of it this way. It's the unique ability that humans have to take a step back from the situation and observe the big picture, as though we're standing on top of a mountain looking down at our life. It's the ability to realize what is happening both internally, what we're thinking, feeling, and the emotions we're having, as well as externally, being able to observe the environment, how things are playing out, and what the situation involves. This noticing self allows us also to take different perspectives about the same situation and what is happening, as well as where we want to go after this situation or even during a situation. It's a very neat concept within ACT, but yet it can also be difficult to explain to clients. Now, to the bottom left is cognitive diffusion. Now, cognitive diffusion is about learning to notice when you are getting caught up in or hooked by a thought or an emotion. This is oftentimes called in therapy rumination, or we get clients that do get caught up or hooked by thoughts and emotions, and it's difficult for them to come back to the present moment. In cognitive diffusion, it's about the process of unhooking or stepping back from our thoughts, and in a very non-judgmental way, having awareness to look at the thought and emotions and understand what it's causing you or wanting you to do. Oftentimes, our thoughts and emotions are filled with pain and difficulties and challenges, which the natural urge is to run away from them or escape from them. That is totally natural. One way to unhook from our thoughts is to ask ourselves a very simple question. Is following this particular thought or emotion that I'm having going to lead me toward the person that I want to become or toward a more meaningful and fulfilling life? For many of our clients, as they examine those thoughts that they are ruminating upon, they can usually easily ask that question and identify in a very non-judgmental way that following that particular thought will not likely lead them toward the person or life they want to live. Let's move finally up to the upper left, which is experiential acceptance. Now, experiential acceptance is the process of practicing non-judgmental awareness to both internal and external events. It's accepting that life is filled with difficult, challenging, and uncomfortable thoughts and emotions, yet we don't have to have those define us. In fact, as we feel those, we also don't have to run away from those or attempt to escape those. In fact, it's the process of running away and attempting to escape those or fight back against those is oftentimes what creates psychological distress. We can begin to accept that running away is part of creating the problem. In ACT, we call it dropping the struggle, which means we come to an acceptance that what we're feeling, thinking in the moment is not going to hurt us. Although it's very difficult and uncomfortable and challenging, it does not have to define us, nor do we have to run away from it. It's, again, the process of actually dropping the struggle or dropping the tug of war and fighting back and beginning to accept that those feelings, thoughts, and emotions are part of living And as we turn towards our values and take committed action and focus on those values, we can begin to accept those difficult thoughts and emotions. The inverse of experiential acceptance is experiential avoidance, which is this natural human tendency to want to fight against or escape our difficult and challenging thoughts. Again, this provides temporary relief, but in the long run, those thoughts stick with us, those emotions stick with us, and in the end, we didn't gain much or didn't head towards the person that we want to be. This is a summary of the Hexaflex model. It's important to go back and understand each of the core concepts and how they relate to psychological flexibility. Again, each one connecting to another depending on where the client's at and what they're struggling with at the time. So how do we know if we've achieved psychological flexibility? Well, we can understand this by asking what's called the ACT question. This begins at the bottom with self as context. Now, the ACT question is pretty long, but it does link each of the concepts together very well. So let's start off. Given the distinction between you and the thing that you're struggling with, are you willing to experience that thing fully and without defense as it is and not as what it says it is, and do what takes you in the direction of your chosen values at this time and in this situation? If you can answer yes to that question, then you've achieved psychological flexibility. Now, if the Hexaflex is not quite your thing, try the ACT triangle. If we look at this ACT triangle, it summarizes or boils down the 6 core concepts into 3 main concepts. The top of the triangle is be present. It reminds clients that contacting the present moment, noticing and being aware of what's happening around us, and taking a perspective of our situations, our thoughts and emotions, allows the client to stay in touch in the here and now. It is what makes life meaningful and fulfilling, because we are living in the present moment rather than being pulled to the past or worrying about an unwritten future. Now, the concept to the bottom right is about doing what matters. So in difficult, challenging, uncomfortable moments, as well as in pleasurable and happy moments, it's doing what matters in the service of our values and taking committed action, meaning doing things that are aligned with what's important to us or who is important to us. Now, finally, in the bottom left corner, it's about opening up. This allows us to accept the thoughts that come into our mind or the emotions that we're having in a non-judgmental way, being mindful that our thoughts do not define us, nor do our emotions define us. It's normal to have thousands of thoughts a day. However, being hooked by every thought or beginning to believe what the thought is telling us, once again, is what oftentimes causes psychological distress. It's being hooked through the thought and believing that that thought is who we are is what creates oftentimes depression and anxiety. The process of opening up involves accepting in a non-judgmental and mindful way that our thoughts are oftentimes like clouds passing through the sky or leaves on a stream. It's seeing them for what they are and not what they want us to be. This is the ACT triangle that has the same core concepts as the ACT Hexaflex, just in a different form. Once again, all in the service of what's in the middle, which is psychological flexibility. Practicing each of these concepts of being present, opening up, and then doing what matters, even in difficult, challenging, and uncomfortable times. If I were to ask you the question, what defines you, how might you answer that question? As an ACT therapist, we work with clients to understand that their thoughts, emotions, and memories do not have to define who they are. Certainly they can influence who we are, and certainly they have shaped who we are through much of our lives. However, for many of our clients that suffer from depression, anxiety, stress, and other conditions, it's this fusion or getting hooked or entangled with their thoughts and emotions that causes much of the psychological distress that they experience in their everyday lives. They begin to define themselves from what their thoughts tell them they are or their emotions tell them they are, rather than them beginning to be empowered to take choices towards those things that are important to them and taking steps to define their own life. That really is the thrust of ACT therapy, is beginning to have clients notice and accept what they're experiencing and what they're thinking, beginning to unhook from and take a step back from those thoughts and emotions, and then turning towards and aiming towards those things that are important to them, those values that help drive and provide meaning in their lives. Now, this is a process that can take quite some time because for many of our clients, their thoughts, emotions, and memories have defined who they are through much of their lives. This can take some time. However, with self-compassion, with empathy, clients can begin to learn that trusting in their values and taking active steps towards who or what is important to them or who they want to become is something that can bring fulfillment and meaning to their life. They can begin to make choices to define their life, not their thoughts and not their emotions. So what thoughts define you? In ACT, we work with clients to help them notice and become aware and mindful of their mind. The mind can be a great help to us as humans. It helps protect us. It helps us want to conserve energy and keep us safe. However, the mind can also do the opposite. It can be overprotective and also want us to take the easier route to escape or avoid painful or difficult or uncomfortable things. Now, this may seem logical, and in fact, it can provide some temporary relief. However, for the most part, it can take us away from our values and those things that are important to us. Understanding and becoming aware of our thoughts is a critical part of ACT. Many of the core concepts involve noticing, becoming aware and mindful of our thoughts and emotions. It's noticing what our mind is wanting us to do, and then stepping back and asking ourselves what we want to do, those things that are important to us. It also involves asking ourselves questions such as, what thoughts are leading towards a more meaningful and fulfilling life or towards our highest self? For many of our clients, they have had thoughts throughout their lives that keep them stuck and have led them away from a more meaningful life. In fact, these thoughts have caused much of their pain in their life. That pain oftentimes results in taking behaviors or doing behaviors that attempt to reduce this pain or escape from the struggle of these thoughts. Once again, there is plenty of room in ACT for empathy and normalizing that this is a normal part of life to want to reduce pain or escape. However, in the end, we get stuck in a cycle which moves us away from those things that are important to us and moves us away of who we want to become or those things that are important to us in our lives. So, helping clients to understand that the mind can both be helpful and can try to cause us to take actions that are not aligned with our values is part of this mindfulness process and this awareness process of ACT. It's noticing our mind and what it's trying to have us do, and then taking power back to ourselves of what we want to do. If I were to ask you what behaviors define you, how might you answer that question? Well, similar to the previous slide, in ACT we emphasize beginning to take committed action or doing behaviors that lead to a more meaningful and fulfilling life based on your values, which is who or what is important to you. It's also taking committed action towards the person you want to become, even in the midst of difficult, challenging, and painful thoughts and emotions or memories. For many of our clients, they've become stuck in a pattern of wanting to reduce pain and discomfort by taking actions that provide temporary relief. However, in the long run, it has kept them stuck in a pattern of avoidance and escape. In ACT, we help clients realize that this stuck pattern is what continues to cause them to feel distress as they move away from who or what is important to them or away from the life that they want to lead. As an ACT therapist, we help clients begin to take power back from those difficult thoughts and emotions by being aware and mindful of those thoughts and what our mind and body want us to do, and instead begin to pivot towards and aim towards those values that will lead them towards a more meaningful and fulfilling life, even in the midst of difficult thoughts, emotions, and painful memories. As they begin to take active steps and committed action towards those values and towards those things that are important to them, they can break the cycle that has kept them stuck. It's taking committed action that is a critical and core concept of ACT. Part of being psychologically flexible is also understanding that there are many things external to us that are beyond our control. This can be a difficult concept for many of our clients because oftentimes things outside of their control define who they are or influence how they feel about themselves. Once again, much of this is natural, and we need to show empathy and compassion towards that. And at the same time, it's important for clients to accept and become mindful that life is in constant change, that being defined by or placing their identity in things that can be taken away, are temporary in nature, that are based on something or someone or on situations beyond their control, is what oftentimes can cause this psychological distress. Being defined by things outside their control contributes to depression and anxiety. Getting clients to begin to trust in themselves and to trust in their values and to take committed action towards those things that are important to them is the thrust and main concept of ACT. It's clients living in the present moment, valuing things and people in the here and now to create meaning, and accepting that those things come and go as a natural part of life. Clarifying and being guided by values is an important part of the ACT model. Now, values are different from goals. Values are more like the direction that we want to head in, whereas goals are those mile markers along our journey that can be achieved, and we know when we accomplish them. It's important for clients to understand also that we are all on our own journeys. Such as this picture here, we all have our mountains to climb. We all go through difficult, painful, and challenging moments. And yet at the same time, we can be guided by our values to head in the direction that we want to head, despite those challenges. This is truly an important concept that involves all 6 core concepts. That ultimately being guided by our values involves living in the present moment, accepting those thoughts, emotions, and memories that we have along the way, understanding that our thoughts do not have to define us, nor do our emotions have to define who we are or how we behave. It's taking committed action, even in the midst of uncomfortable and challenging times, in the service of our values being our ultimate guide and direction. This is the main and core concept that leads to psychological flexibility on each of our journeys as we face our own mountains here in life. When faced with life's challenges, there are several questions that we can explore with clients or even with ourselves to gain better insight into those things that can help guide us through those challenging times. One question is to ask ourselves what values and beliefs have guided us through previous difficult times. As we explore that question with clients, they oftentimes begin to develop insight or can see those things of who or what was important to them that helped guide them through those challenging or even painful moments in their lives. We can then take those responses and help them apply those in the present moment. That can be a valuable activity for clients. Another question is to ask, how would their best self face the current challenge? This can be an important question as we take a step back using the concept of self as context to look at our life from a different perspective. What does our thoughts and emotions and memories want us to do and behave to escape or avoid the challenging or painful times? And how would our best self face the moment? Who do we want to become, and what would that involve? This would be a great question and valuable question to explore with clients. Another question is, what advice would they give to a loved one that they cared for that was facing a similar challenge? Humans are very good at oftentimes providing solid and genuine advice to those that are cared for or loved for as to what they would have them do. Their advice is usually based on their own values of what helps them through difficult times. This insight can also then be brought to the present moment as clients begin to realize that the advice they would give to others would be important for them to take themselves. And finally, what do clients want to be known for? This question can be a very deep and probing question to help clients understand that their past does not have to define their current moment, that they can begin to define who they want to be known for and what they want to be known for. This can be a deepening experience for clients as they understand that the change and constant flux of life doesn't have to change who they are, and they can begin to define themselves. In ACT therapy, we want our clients to be psychologically flexible on a daily basis. ACT therapy is more than just a set of skills to try to fix problems or symptoms. It is a way of life and a way of being on a daily basis. I have my clients ask themselves the question, what would happen? In a very experimental way, having them begin to explore what would happen on a daily basis if they began to make decisions to live their life in a more meaningful and fulfilling way, even in the midst of painful, emotional, or uncomfortable thoughts, feelings, or memories. You can also ask the question of what daily steps are they taking towards becoming the person they want to become. This is also a helpful question to have clients reflect on a daily basis what they're doing in order to achieve their goals in the direction of their values and what committed actions they're taking, not just once in a while, but on a daily basis. That's what we want to emphasize in ACT, is how are clients using each of the 6 core principles and concepts to improve their life, to achieve a more meaningful and fulfilling, enriching way of living on a daily basis. This was a basic introduction to ACT. However, there's so much more to learn. ACT is such a dynamic modality that it's going to require further training and studying in order to truly understand the 6 core concepts and how they're used together to help clients develop psychological flexibility. I encourage you to look for additional videos and authors. I recommend the creator of ACT, Dr. Stephen Hayes, or also Russ Harris, who is an excellent author and has produced multiple videos. I encourage you to look at my YouTube channel, Dr. Nate's Mental Health Education, for further videos about ACT as well as other modalities. Thanks so much. We'll see you there.